We no longer have the fee for service,
Right.
Which means that the physicians are no longer able to charge a certain fee. I mean, you create with managed care sort of a uniformity among physicians in terms of services, do you not?
In managed care, you have several ways of paying physicians.
Good.
Primary care physicians, and that's the internist, the pediatrician, the general practitioner, the family practitioners. Those are paid on, I'd say, a capitation basis. You assign them like 300 patients, and you pay them so much for each patient to take care of them. The fee-for-service, or the specialists, the cardiologists, the radiologists, they're still paid on a fee-for-service, but on a discounted basis, much discounted in terms of the system. But you have contractual relationship with these people to transfer patients from the primary care to the specialist, and you manage that process. So we still have fee-for-service medicine, but it's in a managed care setting, and it's only for a segment of the physician community. Hospitals are paid on a per diem. I mean, we pay Harry Hubbard hospitals $600 a day, no matter how long they stay in the hospital. Or we pay Vanderbilt maybe $800 a day, depending upon the cost structure of that hospital. But and those rates are negotiated between the managed care organization and the doctors, the managed care organizations and the hospital, managed care organization and the pharmacy, managed care organization and the lab company. All of those rates are negotiated. They're different for each one of us. I mean, whereas before you had one rate across the state, there's different for every one of them.
And so there's no real substance to the complaints that some folks are making in terms of TennCare, for example, because TennCare does represent that managed kind of care. There's no real substance to the complaints that physicians don't agree with the system, that physicians are having a hard time, and that there might be some possibilities of perhaps now removing that system.
Well, I think the system is here to stay.
That's what we're looking for.
That's right. The system is here to stay. We've already gone through a headache to get it in, so I don't think it's going to go away. But the main problem with the medical community with TennCare has been, first, that they were not consulted in the development of TennCare. And the number two problem is that the state said, if you're going to participate in serving our state employees, you must also serve TennCare. And that tie-in upset a lot of people in the medical community.
They sort of forces, they felt as if they didn't have a choice in terms of whether or not they would decide to join TennCare.
That's right, and that upset the TMA. They also think it's not funded properly and a few things like that. And I will say that the rates are unusually low. They were probably not actuarially determined, but the point is that you just have to manage to it. The state was about to go, I wouldn't say bankrupt, but it was not going to be able to provide the services that the Medicaid people were used to. I mean, right now, a person on TennCare can get 365 days of hospital care. Well, under the old Medicaid, it may be 30 days. There's a significant difference in what's possible now under TennCare as opposed to the Medicaid program.
And so the administrative cost it was a real problem in terms of the delivery of service under Medicare.
It was an administrative cost, not only administrative cost, but it was also the cost of contracts. I mean, you had, as I said, in the old fee-for-service system, you go to the doctor, you go to any doctor you want to, you go to ER rooms all the time. Well, under TennCare, we manage your visit to the ER room. You go when you really have an emergency. You call our nurse and we'll talk to you on the telephone, and we may find that because your fever is not high enough to go, you may just take aspirin and go to bed.
You know, now, and I think it has to be acknowledged here, Mr. Howard, that the Pheonix Healthcare Corporation is an historical black corporation. Let's talk about it from that perspective. I mean, simply from a minority perspective, what does it mean for a minority to be involved in the managed care health system, whether from an ownership position as you own Pheonix Healthcare Corporation, or from a medical position as physicians and etc. Let's talk about it from that perspective.
Sure.
Give us from that part of it.
There are 3 managed care organizations in TennCare that are operated by blacks. Access, MedPlus, and Omni in Memphis, and Pheonix Healthcare Corporation. What this means is basically $400 million is going through the black community in terms of economic development. That's in the management of those individuals. It means also jobs. We have about 50 people. I don't know how many Access Med Plus has. We have 50 employees. I would say we're a very diverse company. We have about 60%, maybe 60% of our people are minorities. We have many people. As a matter of fact, when I think about our company, we probably have only 5 people that have HMO experience. The rest were graduates of Fisk, of TSU, or and other institutions that are now working for us. I would say that what this means is that Pheonix Healthcare, we have the potential of being a significant healthcare provider or health insurer in the southeastern United States. We are going to be a large company. It's my hope that we'll be publicly held at some point in time, and that we'll have probably one of the most diverse staffs in terms of ethnic breakdown of any in the market. It shows it can be done. But I will say this, it didn't come with a lot of work. I mean, without a lot of work. I have a 7-day-a-week, and most of my people have 10-hour days. So you have to work at these kind of things to make them happen. But I think we'll be all right.
And so when you look at managed health care, that there is a place for minorities within that system. Yeah, that's
but you have to step up to the plate. You have to step up to the plate and take the risk. There is no set-aside in this business. I mean, they didn't say X percent is going to minorities. You have to just put your money in there, and you advertise, and you go out and set up a proper network, and you compete.
And I think that since this is going this Sunday morning, I think that we're a couple of days from